This video shows a repair of a partial subscapularis rupture. The biceps tendon is dislocated or subluxated and torn. The first thing is to release the biceps tendon, which is later tenodised during this case. You can see the subscap tear. The lateral hood is intact, but the medial articular superior part of the subscap is torn. So we need to release the rotator interval to give us room to work. So we could create a working interval. And then I make an anterolateral portal, and I use a spinal needle to get my right angle so I can debride the lesser tuberosity. I switch it to a Wissinger rod, and then I establish the cannula. I then went ahead and bring the shaver in and debride the lesser tuberosity. This is followed by an anchor. I prefer to tie knots instead of using knotless anchors for the subscap. So we tap and we make sure that this angle is critical, and usually the butt of the tap is near the patient's face in a V chair position. We then have to pass the sutures from the anterior portal to the anterolateral portal. I then know that the subscap fails in continuity, so I'm going to reestablish my anterior portal, and I'm going to use a penetrator, and I'm going to penetrate where the good tissue is, so I completely repair the footprint down to bone. So I first penetrate deep into the tendon, or distal, and then I grab a suture and I make sure they're not tangled and bring it down to the penetrator. And then that's my first throw. Now this is going to be a horizontal mattress, so that's the first throw of the horizontal mattress. And then I pass superficial, and this is the second limb of the horizontal mattress. And I use my other hand to pass the suture to me. So now I have a horizontal mattress, and what I'm going to do is pass a vertical mattress behind the horizontal mattress. So you can see there I pass the penetrator behind the two limbs of the horizontal mattress. So in essence, I'm creating an arthroscopic Mason-Allen suture. And that blue thread is the vertical mattress. I'm going to tie down the horizontal mattress first, and it's going to compress my tendon back down to its footprint. And then after that is tied, I tie down the vertical mattress suture, completing the repair. Now you can see the superior edge is back to where it normally is, and that completes the subscap repair.